All right, Dr. Jenkins here doing the blood vessels on the human model. In the lab we have two human models, one with a white background, one with a green background. Make sure you look at both. My camera will be a little bit shaky. I'm doing the best that I can, but we'll go on nonetheless. Let's start with the heart. Coming off the heart, we'll do arteries first. There are four regions to the aorta. Ascending aorta, aortic arch. It goes behind the heart here, and at that point it's called the descending thoracic aorta. You can't see it because it's behind the heart, but you should still know it's there. Ascending aorta, aortic arch, descending thoracic aorta. Once we get past the diaphragm, it becomes the descending abdominal aorta. Next, I would suggest looking at what are the three branches coming off of the aortic arch. In the human, there are the brachiocephalic, left common carotid, left subclavian artery. Okay, so the three branches going from right to left. Remember, it will be right on that person. Brachiocephalic artery, left common carotid, left subclavian. If we follow these up, the brachiocephalic artery comes up, and quickly splitting off of it is the right common carotid. The carotids go up to the head. The left common carotid just happens to come off the aortic arch, where the right common carotid comes off the brachiocephalic. Okay? Let's go ahead and follow for example, left subclavian artery. As it goes down, it changes name. It's the same vessel, it just changes name. Coming off the aortic arch, this is the left subclavian artery. The same vessel continues, but as we get to this region, it becomes the axillary, because axillary means armpit. By the way, subclavian, it's named that because it's underneath where the clavicle is. So left subclavian, then it becomes the axillary near the armpit, then it becomes the brachial in the arm, and as we continue further down, not a great look on this side, but we have the ulnar artery, pinky side, radial artery, thumb side. It's a little bit different on the right side. Everything goes back to the three branches coming off the aortic arch. This is the brachiocephalic artery. Then it becomes the left subclavian. Right subclavian. So brachiocephalic is first. After the right common carotid branch is off, then it becomes the right subclavian, right axillary, right brachial, and then right ulnar and radial. When we talk about the arteries of the gut, as I'm going to show you in a different video, I like to memorize 5 branches coming off of the descending abdominal aorta. Celiac trunk is number 1, superior mesenteric number 2, renal number 3. Renal you can always tell because it goes to the kidneys. On this white background model, we only see the inferior mesenteric. So we have celiac trunk, inferior mesenteric, renal, superior, let me say that again. Celiac trunk, superior mesenteric, renal, inferior mesenteric. If I go to the green background, we see all 5 branches. Celiac trunk, superior mesenteric, renal, gonadal, because it goes down to the gonads, and inferior mesenteric, which is only one side. Coming off the celiac trunk, we have the common hepatic. You can tell these because of the organ it goes to. Hepatic means liver, so the common hepatic artery goes to the liver. The splenic artery goes to the spleen. This is the left gastric artery because it would go to the stomach. Okay? Looking down below, if we continue following the descending abdominal aorta, then at wishbones it splits into the right and left common iliac artery. That same vessel, this for example is the left common iliac artery, becomes the left, hold on for a second, common iliac, right, then it becomes the left external iliac. Been a long winter break for me, huh? So we have the common iliac arteries, then it becomes external iliac. That name change happens where the interior iliac splits off. So before the interior iliac splits off, it is the right and left common iliac arteries. Then the right and left internal iliac arteries branch off, and the same vessel is now known as the external iliac artery. It continues down to become the femoral artery. Behind the knee, it's called the popliteal or popliteal. I say popliteal, some say popliteal. And then we have a posterior tibial, because it's posterior, and an anterior tibial that's anterior. Okay? This will be the left common iliac artery, left external iliac artery, left internal iliac artery. The left external iliac artery becomes the femoral artery in the thigh. It becomes the popliteal artery behind the knee, and then it becomes the anterior tibial artery going anterior and posterior tibial artery going posterior. Great. Let's talk about veins. Starting from the heart, we have a superior vena cava. This is where the blood from the head and upper body drains in the right atrium, superior vena cava. And we have the inferior vena cava. The inferior vena cava brings blood up from the whole lower body and torso. You'll notice the inferior vena cava lies pretty close right beside the aorta, just blood traveling in a different direction. Superior vena cava, inferior vena cava. If we go up top, the superior vena cava splits off into a brachiocephalic, subclavian, axillaries in the armpit, and then here it's a little bit different, okay? Here, now a couple things. It's actually better on this one, maybe a little bit. So we have the superior vena cava. This will be the left brachiocephalic, and only between here and here is the right brachiocephalic. Kind of hard to see. Just memorize the order. The first branches coming into the superior vena cava are the brachiocephalic. Coming off the brachiocephalic veins are the jugulars. These are the external jugulars. And then you can see up here, the external jugular, we have an internal jugular splitting off towards the inside. This will be the left external jugular, right external jugular. This will be the left internal jugular, where the external keeps going up. So it's the same name chain as for the arteries, really. Brachiocephalic, then it becomes subclavian, then it becomes axillary vein. There's a difference here in the arm. The brachial artery continues to run down, the brachial vein continues to run right down the middle. You can't see it here because they cut it off. But imagine the brachial vein runs right alongside the brachial artery. But then we have an added vein on the medial side, inside, and an added vein on the external or outside. The outside vein here is called the cephalic vein, and the inside vein is called the basilic. I remember basilic because BO, body odor, is close to the armpit, and B is in basilic. That's how I remember it. So the brachial artery continues down the middle, even though it's not shown. The medial one is the basilic vein. I said artery meant vein before. Basilic vein, and this is cephalic vein. Of course, after the brachial comes down, lower, we have the ulnar vein, pinky side, and radial vein, thumb side. One added vein here is the median cubital vein. Kind of crosses the antecubital space or the front part of the elbow. Okay. In the gut, as you'll see a different video I'm going to record for you, we only have 3 branches coming directly off of the inferior vena cava. Hepatic vein, renal vein, and gonadal vein. It doesn't show you a vein, but it's there. So memorize the 3 branches of veins coming directly off the inferior vena cava. Hepatic vein, renal vein goes to the kidney, and then there would be a gonadal vein alongside this. Let's talk about the bottom. This is going to be almost exactly the same as the arteries. So inferior vena cava splits into a right and left common iliac vein. Then we have an external iliac vein. Internal iliac vein is here. So common, this would be the right common iliac vein, right external iliac vein, right internal iliac vein. The external iliac vein continues down. It's cut off here, but it's cut off here and it continues here. This would be the femoral vein. Of course, behind the knee, it would run right alongside here. It would be called the popliteal vein. And then we have the anterior and posterior tibial vein. So this would be the, anterior tibial vein, posterior tibial vein. The added vein here in the lower body is the great saphenous vein. Remember, the femoral vein is going to go kind of deeper, and the femoral vein runs right alongside the femoral artery. But there's an added vein that's more superficial. We'll see it in the cats, called the great saphenous vein. Okay, great. Good luck with the models of the human blood vessels.